educational backgrounds as well.
Identify and treat hyperlipidemia.
So we can get them good care quickly.
What inspired me to get into medicine.
And we wanted to make sure that we raise our kids.
Tailor our therapy specifically to this population.
Welcome back to Healthy Living on India Life Television. We have important information to share with you, and for that we have many doctors in our show. So let's continue the show. Doctor, you have explained to us why you choose this community, but now let's talk about your practice.
Sure. After finishing my education in Interventional Cardiology Fellowship, I started a practice named Brookhaven Heart, originally in Patchogue, Suffolk County, New York. Subsequently, we grew into two locations in Nassau County, one in New Hyde Park and one in Hicksville. Hicksville is presently closed for renovation. We expect it to open in 4 to 6 months' time. Our practice is owned and operated by physicians, which gives us the flexibility to meet the needs of the community and have a variety of features which helps to meet the challenges our patients and community faces. We have evening hours, we have weekend hours, we take same-day appointments, we take all the insurances. Our physician speaks multiple languages, come from varying cultural backgrounds and educational backgrounds as well. So they are, and as well as our staff who speaks multiple languages. Our facilities are state-of-the-art with all the equipment. We also have facility to book online appointments. We have affordable self-pay solutions for patients who don't have insurance, and patients who face economic hardship have the options to get discounted or subsidized care, or sometimes free care, provided that they provide documentation, which is supported documentation. So in a variety of ways, we try to be different from other practices in our neighborhood. We also have a laboratory which can perform most of the commonly performed tests. These are the features which makes our practice different from other practices.
Dr. Saurin Patel, would you be able to elaborate a little bit about yourself?
Thank you, Tara, for inviting me to the show, and all of us as well. I was born and raised in Boston, Massachusetts, and I did all my education in New York and Boston as well. And then after I finished all of my medical education training, I actually spent several years working and practicing as a cardiologist in India. After working in India for several years, I moved back to the United States and eventually landed up here in Long Island, where I live with my wife and 2 small children. I specialize in interventional cardiology, doing angioplasties and stents, and I also specifically specialize in vascular medicine, in treating patients with non-healing leg wounds and ulcers and varicose veins. So what you can ask me is, say that given your experience of working both in India and in the United States, what do you see as the key differences in the practice of cardiology?
Dr. Saurin, since you have worked in India and US, what do you say, talk about the key difference between the Indian population and the US population based on the cardiac standpoint?
That's a great question, Tara, and thank you for asking that. The Indian community, both in India and the US, has a lot of differences in terms of our risk for developing heart disease. And unfortunately, the Indian community at large has an increased risk of developing heart disease, and we need to tailor our therapy specifically to this population. When we look at the studies that are done in the medical community in the United States, they mostly focus on white Americans, some Hispanics, some blacks, but mostly Indians are left out of those studies, so we don't have enough information to be able to know how the Indian population should be treated. We do know that the risk is higher in the Indian population. We do know that Indians develop heart disease at a younger age. We do know that cholesterol levels tend to be very different in the Indian population. We know that diabetes is rampant in the Indian population, and all of these are things that lead to a higher risk of having heart disease within the Indian population. And we as a group here are happy to be taking care of a very large and diverse Indian population in the Queens, Long Island area. And with our knowledge and expertise, we're able to tailor services and therapies specifically to the Indian community.
Dr. Deepu Alexander, would you be able to give us a brief journey of your career as a cardiologist?
Thank you, Tara, for having me and my colleagues here. My background is that I'm from Kerala. I did my schooling in Trivandrum, followed by in the Middle East, my high school. I did my medical training at Kastuba in Mangalore, then in cardiology and internal medicine and cardiology at Stony Brook Hospital, and I joined Brookhaven Heart in 2012 and have been there ever since.
Yeah, we heard about your career side, but we would like to know like whether you live in Long Island and how long are you be here? You are within the same community?
Yes, I've been in Long Island since 2004. That's when I came to Stony Brook Hospital to do my residency training. I'm married with 3 children. My eldest one is in just about to start college. The rest are in high school right now.
Dr. Alexander, what are the preventive measures that we all can take to promote a healthy heart?
Thank you, Tara, for this question. I think from a preventative standpoint, I think the basics are the most important here. In terms of identifying and treating hypertension, hyperlipidemia, these are all very important. In our population, especially in the South Indian population, there is a lot of diabetes and pre-diabetes, that is the beginning stage of diabetes per se. And even in that population, there is a role in identifying heart disease early on. We can do screening methods, which I would say that for primary care physicians, they should identify and treat hyperlipidemia. Hypertension should be treated to goals. Calcium score is an option where we can actually identify coronary atherosclerosis. These are all ways that we can actually identify disease and potentially treat them.
Our viewers around the world, we need to take a short break. There is so much to talk about in our show, Healthy Living. And we have many more doctors who will be sharing the important and vital medical information about heart health, which is important to all. We'll be right back.
And education backgrounds as well.
Identify and treat hyperlipidemia.